What is an ambulatory EEG and how do you prepare? Imagine being able to record your brain's activity while you go about your daily life. That's exactly what an ambulatory EEG allows. It's a special test that captures your brain's electrical signals over a long period, usually between 24 and 72 hours, while you're at home or doing your normal routines. This makes it different from a standard EEG, which is done in a clinic and lasts only about 20 to 60 minutes. The longer recording helps doctors see what happens during your usual activities and sleep, which can be very important when diagnosing epilepsy or other seizure disorders. During the test, small metal discs called electrodes are attached to your scalp using a gentle adhesive. These electrodes pick up the electrical signals from your brain. Wires connect the electrodes to a portable device, often worn on a belt or shoulder strap. This device records your brain activity continuously. Some systems include a push button that you or a caregiver can press if you notice a seizure or unusual event. This helps doctors match what you experience with what's happening in your brain at that moment. Ambulatory EEGs are especially helpful if your seizures are rare or happen only during certain activities. They can help tell if your episodes are caused by epilepsy or something else. They also help identify the type of seizures you have, how often they occur, and if certain triggers might be involved. Sometimes, they reveal patterns or triggers that only happen outside the hospital setting. However, not everyone needs an ambulatory EEG. Many times, a standard EEG and a detailed medical history are enough for diagnosis. Getting ready for an ambulatory EEG is simple but important. First, wash your hair the night before or the morning of the test. Avoid using conditioners, oils, sprays, or gels because these can prevent the electrodes from sticking properly. Wear comfortable, loose clothing, ideally with a front-opening shirt, so it's easier to put on and remove the electrodes without disturbing them. You should continue your usual daily activities, including eating and taking your medications, unless your doctor advises otherwise. Bring a list of all your current medications to your appointment. If you have hair extensions, braids, or weaves, check with your healthcare provider beforehand, as these might need to be removed. It's also helpful to keep a diary of your activities and any symptoms you experience during the recording period. This information helps your doctor interpret the results more accurately. After the recording is finished, the electrodes and device are carefully removed. The data collected is then analyzed by a specialist, and results are usually ready within a week. Your doctor will review the findings with you and discuss what they mean for your diagnosis and treatment plan. For people with epilepsy or seizure concerns, an ambulatory EEG offers a valuable window into what happens in your brain during real-life situations. It's a safe, non-invasive test that doesn't require hospital stays. Following the preparation instructions closely helps ensure the recording is clear and useful. Remember, always talk to your healthcare provider about whether this test is right for you and how to prepare properly. This test is just one part of a comprehensive approach to understanding and managing epilepsy, guided by medical professionals who can tailor advice to your individual needs.